Greetings from EPRN Rwanda again. This is your host Aline Gaunziza. We are going to be talking about the insight on economic situation of Rwanda within COVID-19. And today I'm not alone. We have a guest. Please, can you start introducing yourself and telling us your names and the background of the topic?
Thank you, Aline, for organizing this fantastic interview. My name is Willis Okul. I work as a consultant with specialization in monitoring and evaluation and project management. I've worked in Rwanda for the last more than 6 years, working on supporting various organizations in the areas of project management, evaluations, baselines, and trainings on M&E. This is a very interesting topic that you've picked today, discussions on COVID-19 pandemic. We all remember that it was a very big surprise for the entire globe when the COVID-19 pandemic started way back in March 2020. When the first occurrence of the COVID-19 pandemic within Rwanda was a big shocker to many because everything went to a standstill all of a sudden without any preparations. I remember when people tried to, buy goods to stock in houses, not knowing when it would open or when they would get their next food after about 1 week. This was really particularly very devastating for the lower cadre of people, lower cadre of income earners, people who live from hand to mouth, people who must depend on daily work. This was a very big effect on them. And I think up to now they've tried to recover, but not as much. Because some of their livelihoods or sources of where they could work also closed, and they've not managed to come back to full operation. The government has tried so much. I must admit that the government has done quite a lot within its powers. And this has seen us come up to today with manageable effects on the pandemic. People have come back to schools now. Schools have reopened. Most of the workplaces have been reopened and people are able to go to work now. Probably some of them are still 30%, but there's now a sense of hope for most of the people. We must commend the government for the efforts that they've done on all this.
One of the key sectors of the economy, there is health, education, tourism, agriculture, food security, trade and industry. Can you try to tell us the impact of COVID-19 on those key sectors and try to compare from the first lockdown and the second lockdown?
Thank you for the question, Aline. I think overall there has been devastating effects on all the sectors, given that all human movement was stopped, all trade was disrupted. Yeah, this had devastating effect. And coming specifically to the sectors, one, health, we noted a lot of overwhelming response, especially when people flocked hospitals, not knowing. And the other frustrating thing is that people didn't know exactly what this disease was all about. But still, the healthcare workers or the hospitals still had a mandate, to ensure that they respond to the pandemic and see how to respond. But thanks again to the government for the quick action in terms of lockdown, quarantine, and slowing down movements, just to slow the spread of the pandemic as well. The health sector had to spend much more in terms of looking for ways, equipment to respond to this pandemic. Yeah, a lot of money was spent just to prepare people, to prepare hospitals to be able to handle patients. And remember, this is a time that even getting the right medication was not a one-off answer. But every government or everybody tried to look for ways to respond to this pandemic. And thanks to God, it was quickly realized that people needed masks and sanitizers just to be able to, keep themselves safe. And then social distancing. And I think the WHO also worked very well in terms of setting down rules or regulations that could guide people, that could help people live through this pandemic. And we have seen it the last 18 months, the last 1 year. a lot has happened and people have learned a lot. And the new normal is to keep distance, which is a boost to, sanitization. People are becoming cleaner. People are becoming more careful of their surrounding, which is a very good thing. So even other opportunistic diseases like tuberculosis, now maybe this is a way even to try to control it. Yeah. Jumping into the other sector of education, we saw people being out of school for more than 8 months. This is very devastating. The parents had to change their styles of handling their children. And I think even in that process, a lot of parents learned how to live with their children, something that was not there before previously, where children used to leave very early to go to school, come back in the evening. The only time they spent, quality time with their parents, was very little. But this was an opportunity now for parents to know their children better and even help them go through their, their study materials. Yeah, especially in the wake of the use of virtual means to try and handle things or even educate children. Yeah. Of course, Rwanda, I think, is lucky because the calendar year was changing to the new system where schools are to start in September. But other countries, I think there are a number of children who have lost a year, one academic year, throughout all the levels of education, be it the basic education, be it the middle level education, even universities. People lost up to 1 year, one academic year. Yeah. So that is very, very difficult. And even teachers in private schools, they've lost their income, they lost their opportunities for livelihoods. The workers in schools, the earnings in schools, as for example, the tuition fees that people paid, which could sustain so many other families. All these were affected, and now they are trying to get back to life. And some schools cannot even manage to come back to, normal practice or normal offering of services. Yeah. Then in terms of tourism, we acknowledge that there was no movement all over the world, and this really affected the tourism sector. Hotels were closed, people lost jobs again. Farmers who were supplying them with goods, transport, people who were supplying transport services, they also lost it all. Entertainment services, they also lost it all. So this was very devastating and many people lost their livelihoods. And even until now, with the second lockdown, this has not eased out even for them. Yeah, so we know there are people who cannot manage even a meal, live alone for themselves, but even for their families, and even the other dependents, probably parents, probably siblings, who are dependent on them. So you can imagine how devastating this has really been. And even the general GDP, the earnings to the government, this has really gone down. Yeah. So tax paying has also gone down, collection and all that. Yeah. Yeah, in terms of agriculture and food security, of course, the cyclic movement of goods and services in terms of production, what you put into the farms so that you are able to produce food. These were also affected by the pandemic. There was no movement, in as much as farmers tried to continue, but still, probably transportation to markets, they lost it. And even if they reach the markets, fewer people are able to buy goods continuously. So you find a lot of, reduction in terms of activities and operations within the agriculture sector. Yeah. And then in terms of trade and industry, all these activities depend on trade and industry. We have seen a number of industries that cannot continue. Probably now they're operating at 10%, away from 100%, because they cannot sell their goods. Again, they cannot manage to pay salaries. Again, they cannot manage to bring in raw materials. And even if they manufactured, where do they sell their products or whatever they produce? So this is a cycle, and it has really affected all the sectors in overall.
Thank you for tackling on all the key sectors of the economy. But can you mention efforts that are being made for post-COVID-19 recovery in Rwanda in different sectors?
A good question again. A lot of efforts are being done. I mentioned them earlier. For example, at the beginning of the realization of the pandemic, borders were closed, transport was reduced or closed completely. These are all efforts that have seen us be where we are today in terms of control of the disease or trying to ward it off or trying to close it out. And this has really helped to see people springing back to their lives. I think hospitals have also been equipped. We have seen a number of learning institutions. They have been reorganized or rearranged or reconstructed with the hindsight of, social distancing, in preparation for keeping away or keeping off the pandemic. We have seen people adopting sanitation measures. For example, motors or motorcycle transport system. We have seen people have to wear helmets but with a net or something else inside. You must sanitize your hands. You must sanitize the helmet. In as much as you are not able to keep the distance, but you are able to, make sure you are a little safe from the pandemic. And then a lot of people have realized when they get to their homes, they must wash their hands, they must sanitize. People walk around with their own sanitizers. These were not practices that were there before. But because of the government efforts, people have seen what is happening and they're able to adapt to this. And this is a boost to sanitation all over the country. And all around human well-being. So a lot of efforts have been done. Of course, we saw schools being locked. Currently, we know there's a control of movement still. You cannot move to the provinces. And all these are measures that have been put by the government. Of course, they are looking at their statistics. And then we have seen there's international travel years with a lot of measures. For example, COVID test. When you come in, you must go for quarantine for a certain period. So all these are measures that are very good. And a number of people have gone for tests through this. And through this, they are able to realize whether they are disease-free or they have been infected. And they are able to react very quickly and even go to hospitals or seek medical attention. So these have been very helpful measures overall.
Thank you. What are your opinions regarding of what can be done to ensure the minimum consequence in the period of crisis like this now?
We thank the government for the measures that they put in place, so much so in very short time. We saw in the first pandemic and then now the second pandemic, the measures that have been put in place to ensure that people are safe. We have talked about sanitization, we have talked about social distancing. And then we have mentioned that curfew is key. We have seen what it means to people. Keeping that, limited time in social gatherings. We have seen the measures around weddings, social gatherings. We have seen measures that are in markets where probably people have a timetable for going to markets. You sanitize your hands. These are very good measures. So additionally, probably public education is still key. We still need to really emphasize on public education. And one other thing, I've seen a lot of posters, IEC materials, information education and communication materials. Maybe they should be more enhanced. We should try to spread them more so that people see them, probably even at gates of households. For example, where we are at, this is a university. Probably it would be very good to have a banner or, or some IC materials at the entrance. I know they are costly, but these are measures that would really make sense to a lot of people. Because human behavior, you cannot change it all of a sudden. It has to be something that is drummed over and over again. And overall, I think public education is very, very key. To continue with. Yes. So as we close, thank you very much for the time and the opportunity to talk to you. And we look forward to a zero-free COVID community, wherever we are, within the university, within our offices, and all the areas. And all this depend on us. We have to make sure that we take measures seriously and be able to survive longer. Your health is your wealth, and it is your responsibility to make sure that you are keeping afloat. Thank you very much.
Thank you for accepting our invitation. It was an informative discussion, and I hope all Rwandans and all followers have learned a lot from the discussion. And thanks to the audience. So your health is your wealth. EPRN Rwanda welcome you in following us, in subscribing and clicking on the like and sharing the information to as many as you can. And for more information, you can visit us on our website on www.eprnrwanda.org, or you can visit our offices in Gikondo, in URCB, the former SFB. And remember, your health is your wealth.